attracting everybody's attention here in Dallas County, and that's the Ebola case. And this Ebola patient who is now being treated in Dallas, and it's a question that may come to your office, not too that far in the future. Should he be prosecuted here in Dallas County? Officials in Liberia are thinking about it because he lied on the health form when he left that country. What do you think, Mr. Watkins?
You know, that's an issue that we have been discussing for the last couple of days in the Dallas County District Attorney's Office. It may be more of a federal issue, but we are actively having discussions as to whether or not we need to look into this as relates to a criminal matter.
Are you still gathering information, much like the CDC is about this entire case, but you've got to be looking at it very closely?
You know, we're working with all the different agencies to get to the bottom of it, and if it warrants a Dallas County prosecution, then we will pursue it. But it may be more of a federal issue.
But in his native country, Liberia, community leaders say Duncan was sharing a house with a woman killed by the disease. Duncan rented this room in her family's home in Liberia's capital city, Monrovia. He came into contact with the infected woman who was 7 months pregnant and too sick to walk as recently as September 15th, when he carried her to a taxi, according to the New York Times.
Liberia is a country that we help one another. According to the story, this pregnant woman was walking and was falling off, and then he ran to help her so she can drop and hurt herself.
Wilfred Smallwood says his half-brother Duncan didn't come to the States seeking treatment for Ebola. He planned the trip for 2 weeks and didn't even know he was sick. An airport official says the 42-year-old was screened 3 times before leaving Liberia and was permitted to board the plane, showing no signs of the virus. But Liberian authorities now say Duncan was asked on a health questionnaire if he had cared for an Ebola patient and if he had touched the body of someone who had died in an area where there's Ebola. He answered no.
But the fact that he knew and he left the country is unpardonable, quite frankly. I just hope that nobody else get affected.
Duncan went on to travel some 8,000 miles from Monrovia to Brussels to Washington, D.C., a 3-hour layover, and on to Dallas to visit his son and his son's mother. He was greeted when he arrived with a large cookout, according to the Washington Post. 4 days later, he turned up at this hospital and was sent home, even after telling them he had just traveled from Africa. The hospital admits this information was not fully communicated to the full medical team. He later returned when his condition worsened. Duncan has family across the country, from Arizona to North Carolina. His condition is so serious, they can't talk to him.
I just want to let you know that we're still here. We will not sleep, just like you feeling the pain. We're feeling the pain here too.